Methadone is one of the few opioids that actually directly prolongs the QT interval by inhibiting potassium repolarization channels. So here's our QT interval. Check it out. That's going to be prolonged, and it's infamous for triggering Torsades de Pointes. We're talking about methadone. It's a deadly polymorphic ventricular arrhythmia that can present with palpitations, syncope, and even sudden cardiac death. And so here we'll look at an example of a patient, a 45-year-old woman, chronic pain, high dose of methadone, and she's got a syncopal event, and she reports the intermittent palpitations, and the ECG shows what? It's going to be a prolonged QT. The delta wave in younger patients, not methadone. Deep Q waves lacks the coronary artery disease risk factors. Your sinus pauses, these are common in the elderly, not middle-aged individuals, so don't think of the sinus at this age. And the Mobitz AV blocks, methadone isn't linked to AV blocks. So key features are going to be inhibiting the delay of the rectifier potassium channels, leading to QT prolongation, and also your Torsades de Pointes. So that's your syncope, palpitations, and your sudden death. And high doses and also a slow and variable metabolism are risk factors, and no significant orthostatic changes are required. So if they're young, importantly, you can kind of rule out some of these long QT syndromes. But here she's like a little bit more middle-aged, and she's taking drugs like methadone, which prolong the QT. So methadone prolongs the QT. What else is there to say? If you guys like this video, subscribe for more.